What is a septal perforation plug? Well, the more common used terminology is the septal button. And it's basically a silicone plug or a disc that goes on one side of the nose and another disc goes on the other side, and they kind of snap together in the center of the perforation. The purpose of that is to essentially plug the hole or cover the perforation so that the air can flow through the nose evenly on both sides. What are the benefits of that? Well, if you are having a lot of crusting or nosebleeds, or you're having a lot of pain, or you're getting recurrent infections from the perforation, kind of covering that area and sort of protecting it really can help you relieve a lot of your symptoms. The unfortunate thing is that those plugs or those septal buttons can become a pretty high nuisance for the patient because they build up mucus. They can become crusted, they can shift their position, and sometimes they actually kind of piston back and forth or slide around inside the perforation and can actually damage more tissue. I don't mind them myself as a temporary measure while a patient is waiting to have a definitive surgery, meaning something's going on in their life right now. They're having a lot of symptoms, they plan on having a surgery, but they need some help in the interim. I think those patients are good candidates for the temporary use of a septal button. I'm not a big fan in using septal buttons permanently because I've seen a lot of patients who've had chronic infections because of the button, or the button is not well sized and kind of shifts around inside the nose, causing more damage over many years. And the patients end up having to remove them and then have surgery anyway. So my recommendation is that you get an evaluation in the office. We can tell you what all your treatment options are, and it'd be preferable to just have a definitive treatment, which would be a surgery to close the perforation and then allow you to kind of move on with your life and not have to worry about having a hole in your nose or managing a septal button for the rest of your life. So as soon as you know that you have a perforation, even if you already have a button, I would encourage you to come in and see if you can have it removed and have a surgical repair of your septum so that you won't have to deal with this forever.